Why your doctor is not in COVID-19 vaccination plan. During vaccination campaigns, primary care doctors have an integral role in increasing vaccine confidence in communities. They should be a part of administering COVID-19 vaccines. But why aren't these physicians included in the current pandemic vaccine rollout? The answer? Everything is different from logistics to patients. According to 538, when Americans want to get vaccines, the first thing that comes to mind is primary care doctors near them. They just have to make an appointment or visit the nearest doctor's office to get a jab. Yet, COVID-19 vaccines aren't the usual jabs that you can easily request at any time. At least two obvious factors resulted in the exclusion of primary care doctors. These are logistics and patients who will receive COVID-19 vaccines. Some COVID-19 vaccines go through special distribution channels and require ultra-cold storage, which is something you won't find in doctors' offices. So, you have to get your jabs in assigned vaccination sites. These vaccination sites are also better in vaccinating hordes of patients compared to a typical hospital. Julie Swan, a professor at North Carolina State University, said, "Even if you have more of these individual doctors, if you have 10 mass vaccination sites and each doing 5,000 shots per day, how many doctors would you need if the doctors are only giving 100 vaccinations per day?" Unfortunately, excluding primary care doctors in the COVID-19 vaccine rollout may have a big impact on vaccine confidence. In a 2015 study, researchers surveyed 1,001 Oklahoma adults to learn their trust in 7 media sources, which included healthcare providers. Of 7 media sources, adults expressed the highest trust in their healthcare providers. Around 81% reported them as trustworthy. But not all primary care doctors were removed from the vaccine rollout plans, as per Primary Care Collaborative. The survey, round 25, was conducted from January 15 to 19, and 1,065 physicians in 50 states responded. Of those, 48% were from Texas, Oregon, Virginia, Indiana, and California. 13% were nurse practitioners, and 72% specialized in family medicine. Although 47% of doctors were referring patients to a legit vaccine source, 42% were educating patients, and 30% were outreaching patients. 32% of respondents had no idea when or if their practice would get COVID-19 vaccines. Only about 19% of respondents said that they are currently administering COVID-19 vaccines. For the public, primary care doctors near you can still help you. You can ask them about the vaccines or have them administer other vaccines you may have missed in the past year.